here, we should move on to our next section, which is going to be a panel discussion. And Shobha Rowe, who's been speaking to you as our president here of Kidney Stories Toastmaster, will be taking care of that session. It's going to be addressing long-term recipients, if they've had their transplants for a long period of time. So Shobha, would you take it away and talk to us and introduce your panel and enlighten us on this subject of long-term recipients?
Indeed. Thank you, Bobby. It's my pleasure to be moderating this session as a long-term transplant recipient myself. I have been a transplant recipient for 27 years now. This June, it will be 27 years. So we have 3 recipients in our panel today. I would like to introduce our first recipient, which is Dawn Kirkowski. Dawn is a kidney transplant recipient for 25 years now, and she received her transplant in 2000. Residing in New Jersey with her husband of 17 years, Dawn enjoys writing, painting, cooking, and traveling, and she's embracing her transplant and her second chance at life. Jamie, can you spotlight Dawn, please?
Or how do I do that? Okay, I see her. Just right click on her and then. Okay, there you go.
I'm good. Thanks.
Hey,
Hello.
thanks for joining us today, Dawn.
Thanks for having me. It's my pleasure.
Yes. Let's spotlight George. I did it right now. George Franklin. I'm just so happy to have him here today.
Hi, George. Happy you're here.
He had his kidney disease at 16, and he had his transplant 47 years ago. He had an initial failed transplant in 1975. I know some of us were not even born then. And then after that, he received his second from a deceased donor kidney. And 6 months later, which has lasted for 47 years till now, we would welcome you, George. Thank you for joining us today.
Thank you. And the actual number will be 50 years this November.
Wow.
Oh, wow. Thank you.
It's 49 now.
And I would like to welcome Kathleen I hope I'm pronouncing this right, Montverde, to the panel. Can we spotlight her, Jamie? Kathleen is a liver transplant recipient. And if I'm not mistaken, it's somewhere close to 10 years that she has had her transplant. She's also going to be in our panel today. So we'll have 3 people, Dawn, George, and Kathleen as part of our panel today. Glad to have you all.
Thank you.
Thank you. Hi, Dawn.
Thank
Hello.
you.
Can we add Kathleen, Jimmy?
There she is.
There she is.
Okay.
Welcome, Kathleen. Now, we heard from the doctors, we heard from coordinators, we talked about listing, we talked about medications, we talked about rejection, we talked about so many things. But hearing from experts is one thing, but hearing straight from the recipients who have gone through it all is a totally different one. So to all of you, I have one question. Since we talked so much about medications, so let's start from there. Dr. Shah shared a wonderful list of medication with the prices, everything intact, and saying how many we take. Since I have been a transplant recipient again for 24 years, I started way long in 1998, way back then. So, and for my medications at that point, we had cyclosporin pretty much along with prednisone, a steroid that I take till now. and couple of others, and I take it till today, every single day. So I would like to ask you all just to see how the medicines have evolved over the years. I know it has changed over the years, and if we have faced any complications due to the medications in. So I'd like to start with you, George. Since you're getting close to 50 years, what are the medications
Wow.
that you're taking? And have you had any complications, if at all?
I consider myself, especially after having watched the entire presentation, quite an anomaly because from day one, I was on prednisone and azathioprine. That's all they had in 1975. And I was on those two drugs until I'll say 5 years ago, maybe, when my kidney started slowing down and I started developing gout because of the increased blood uric acid. So my doctor took me off of the Imuran, the azathioprine, and put me on Celsep. So I'm still on 5 milligrams of prednisone, but the only two drugs that I've ever experienced would have been the azathioprine and now the current Celsep. I remember when cyclosporin came out, I did a television spot with the great Dr. Clive Callender, and I remember mispronouncing that word so badly that everybody turned and looked at me because I called it cyclosporin or something. And I've never been so embarrassed as that day on live television. But I've been very, very fortunate. I did have my first kidney never worked. It was taken out just, I think, 3 weeks later. And I stayed on dialysis the entire time. The second transplant, as you mentioned, came in November of the same year, November 4th, to be exact. And I don't know what to say. I mean, my kidney has slowed down drastically over the last 6 years. I had my first biopsy. I know they biopsy everything now all the time, but I had my very first one. I was already over 40 years out, and because it was slowing down and they didn't know why. And so that AlloSure thing, it drew my interest on the previous presentation. But so far, I am doing okay. I go to the transplant games. I've had a child. I've lived my life.
Do you think any kind of diet, exercise, or some lifestyle changes that has helped you come this far?
Well, I try to eat healthy. I truly do. More so now than when I was 25 or 30, when I lived at McDonald's practically and other fast food restaurants. I blew up like a blimp because of the high prednisone at the time. I gained, 70 or 80 pounds. And but since then, I'm my high school weight now. So I'm very proud of that. I try to encourage every recipient, do your labs as frequently as possible. Once a month, I've been doing for 49 years, once a month, because my doctor told me decades ago, that if something were to happen, better to catch it as soon as possible than 5 months down the road when there's really nothing that we can do. I encourage recipients to actually eat healthy. Depending on your transplant, salt is definitely an issue. Hypertension is definitely an issue. It's been for me since I was 16 and in junior high school. So that's about all I can do. My dog is going from one side of the room to the other because when he hears my voice, he gets excited. But now the doctors ask me when I go see them, well, how's Joey doing? Because they know as long as he's here, he's got me walking up and down the hill. And so I do try to exercise. I bowl. I used to swim. I don't swim as much as I have. And I guess that's why I've maintained my high school weight after losing 70 or 80 pounds. But
Thank you, George.
I think it's important for recipients to maintain a healthy diet.
Yes, wonderful insight, especially coming from someone like you. I guess my transplant was in 1998, I think close to Dawn's, which is in 2000s. And cyclosporins was already out by then. So my cyclosporin, Imuran, azathioprine, and prednisone. I'm still on 5 milligram prednisone, and my cheeks are still chubby because of that. I did put on some weight and trying to lose here and there. So I'm sure Dawn can share more. Dawn, yeah, go ahead. Share about your medications, your exercise regimen, if at all, and how healthy are you eating?
Well, honestly, it'll be 25 years September the 6th this year. So I'm getting there. I'm sure it'll be fine. I want to say about medication. So yes, cyclosporin was out. I was given Neoral and told the brand name only. Now a lot of times they're prescribing cyclosporin for transplant, and I was told again brand name only, but my insurance had some issues with coverage because they of course want you to take the generic. And I started with a new nephrologist because unfortunately my initial one of 25 years had passed on. So God bless her. And so the new nephrology office had to get used to prescribing Neoral and telling the pharmacies brand name only. So it was a little issue in the beginning, but I think now they've got it
Excuse me,
straightened out.
Dawn, we're having difficulty hearing you. It's really muffled and like broken
Oh,
up. Can
sorry.
you check your
Here, let me do something.
connection?
Okay. Is that better?
Yeah, I think it's okay. Go ahead.
Okay. So I had a little trouble initially with changing a nephrologist for the Neural brand name only, because they had originally 25 years ago told me Neural brand name only. They weren't doing as much cyclosporin. So that was one of my issues. The other thing is I started with sirolimus originally, and that was interesting because it was a study drug. So it sort of had a number, and they found out I did very well on it, but not so many people did well on it due to the higher white cell counts that could occur with it, and the higher cholesterols. I did get the higher cholesterols, but not the white cell increase. So I'm still on it today at 1 milligram, and I did start out with prednisone. So that I'm still on 5 milligrams of prednisone, which did end up causing diabetes. So I'm still on the same medications today. They didn't really change them yet. My Neural ends up being low, but the doctors have now accepted that because for some reason my body processes Neural very quickly, but they don't want to raise my dose because it could be toxic to the kidney at this point. So that's fine because the less immune suppressed while the kidney is still working good, that's fine by me. It's working, so why change it? So the medication's been okay. Diet and exercise, I try to eat a healthy diet. I'm a big cook. Sometimes I do have my cheat times because this way I don't eat the pint of ice cream. Maybe I'll have a little tiny cup, and I find that effective, just an occasional treat, so that the cravings aren't really there much. So I find to be that my doctor told me that's okay. Have a little, don't overdo it, everything in moderation, exercise. Well, I do a lot of walking, and I even try to walk when I'm at work to go to like a different floor when I'm not busy, because transplant enabled me to become a mental health therapist, which I am now for the last 17 years. So the gift of life has given me the ability, thank God, to help other people, as what I chose as my career. So that was huge for me. I went back and got my master's degree, got married, did things that normal people do, because life wasn't totally normal on dialysis, of course. But I did really well with the medications.
Yeah, I do understand the side effects. Prednisone gave me high blood pressure. I think it increased your sugar. I have a high blood pressure because of prednisone. And I do understand the brand medications you're talking about started with Neoral, only brand. There was a time when they were giving only brand name drugs. We were not allowed to take anything other than that. But somewhere I changed to generic. Now I'm on cyclosporin generic.
Are you doing well with it? Because they tell me don't change, don't change.
Yeah, I think it's all a matter of working with the team. and getting it
Mm-hmm.
adjusted depending on how
It is
your body
cheaper.
reacts.
If I could, it is cheaper. Definitely is cheaper.
Yes, yes, indeed.
But yeah, just the bone loss. To me, the bone loss is a bigger problem
Yeah, I have
now
that
that
too.
I'm older than the diet. Well, the diabetes is chronic, but I do my best. What could I say?
Thank you. Thank you for sharing that. So far, we have good lifestyle, health, diet, exercise, and we are still on the older drugs. Kathleen, who has had a liver transplant,
Yay.
and I'm sure fairly compared to the other two, you are fairly newer transplant patient, I think, in terms of number of years. So let us know about what medications you are taking and if any side effects you're facing and your lifestyle in general.
Just to give you a little background, I was a hospice nurse and a nurse for 30 years when I did get sick, and was totally unaware of what was happening to me, which is kind of strange being a nurse. But now I work for UPMC as an ambassador for living donor transplant. So I'm sort of able to keep up with some of what's happening with medication today compared to what I had happened with me. I'm really interested to know that you're all on prednisone still, because they took me off of prednisone in that first year. I would think it was Cellcept I was on, which no one told us can cause nightmares. And I scared the bejeebies out of my family when I started screaming in the middle of the night. So that got changed. The anti-rejection medicine program has caused me to have chronic high blood pressure. So since I've been put on that, I've had high blood pressure that entire time. And they have me on 3 different blood pressure medications to control it. So that wasn't great. I have dealt a lot with bronchitis. One of the doctors was talking about how you are more susceptible to things. 2 years ago, I think I had bronchitis 7 times in 1 year. So they kept putting me on prednisone. Yeah. Which then put me in the hospital because my sugars went so high. I ended up on insulin. So long story short, today I was on Imuran. That was taken off a couple years ago. I am still on Prograf, 1 milligram in the morning and 1 milligram at night. I'm on a bunch of other medications due to age-related things. I'll be 66 this year, so some things are starting to fall apart. But I'm amazed at some of the people I talk to now that have had transplants, because I talked to them before, during, and after, and they're coming off their medications much quicker than I did. So things have definitely progressed in regards to that. I'm kind of wondering why we're not on prednisone, but all of you are. But I'm glad I'm not, because it has a terrible effect on me. When I did end up in the hospital with the high blood sugars and the insulin, both sliding scale and regular, I asked to be put on Ozempic for the fact that it does help to control the blood sugars. Within 6 months, I was able to get off of the insulin completely, and I've now been on the Ozempic for 2 years. I've lost 25 pounds and have been able to maintain that. I have done jazzercise. I walk every day. I try to stay busy. So sometimes people, when I talk to them, they ask me, well, are you still in a wheelchair, or like, what are you able to do? And when I tell them that I'm not walking every day and I took a jazzercise class, they're just absolutely stunned that this could be what their future can be for them. So I get a lot of very good feelings from being able to give people that hope in those conversations. And that's why I still do what I do today. I was very upset when I became ill, because I was a hospice nurse, thought I found my calling after 30 years of nursing. And I was very depressed that I wasn't going to be able to do that anymore. And then Dr. Ganesh, who's in charge of our UPMC living donor liver transplant, asked me to make the calls. And so I've been doing that for the last 5 years. So I talk to physicians and people all over the country that have called into UPMC to get information about living donor transplant. So I learned a lot from what is happening with them. And then some people I'm able to follow through, like I said before, during, and after. And I'm amazed at how things have changed in just 10 years. You're not on that medication as long. So so I'm doing good. got a hip problem right now, but that's because of age, and I'm trying to get past that so I can get back to jazzercise.
Yeah, thanks, Kathleen.
Nice.
Jamie has mentioned in the chat. Jamie is one of our member in Kidney Stories Toastmasters. She has had both liver and kidney transplant. And she says for liver transplant patients, you are weaned off prednisone earlier, just because apparently the rejection rate is lower for you guys
Oh, cool.
compared to kidney. So which is good. All
Yeah,
good.
I'm happy
As
about
someone who has
that.
been on prednisone for 27 years, I can tell you, yes, you're good.
I really don't know
That's
how
good.
I would
That's
handle
great.
that. I mean, seriously, I was a diabetic, but before the transplant, but if I had to stay on prednisone, I would still be on insulin, I guess. That
Same
would
here.
be,
Yes.
Same here.
yeah,
Same here.
yeah.
So
Yes,
it does
good
cause
for
that.
you.
I wanted to say something. We've all mentioned diet or food or having to lose weight or something. I don't know if he is still on because I can't see the list of participants. But one of the people that logged on mentioned to me yesterday that we were not going, he didn't see diet as a topic. And I think that this organization should very quickly get Oliver Hale on as a speaker. He is a professional chef. He is a transplant recipient. He's had TV show, radio show. He goes to the transplant games. Most of us know him. So by all means, this man knows how to fix food that any recipient would love. And, we all want to reach for the salt shaker. We want something salty or something every now and then, and we're not supposed to have it. So please, whoever organized all this, and I've written down some names here, you all need absolutely get him on board, get him as a speaker, and you will end the diet issue because he will be able to speak proudly on it.
Thanks, George. Thanks for letting us know.
And he will email you a recipe if you contact
Yes,
him.
if you ask
via
him, he
email,
will.
I
and
see
you
that.
need a recipe, he will contact you.
Okay,
Yeah.
I do see him as a participant. I see that he is
Okay.
there in our meeting today.
Okay.
Chef Oliver, if you can please share your email in the chat, it would be helpful for everyone. I'm sure we will definitely have another session where we will have him as a speaker. And I see that he is quite popular. I can
Yes,
see
he
everyone
is.
knows him, which is
He-
wonderful.
he's-
So I'm going to reach out to him
Okay.
for recipes for sure.
Thank you.
I'm for me, I personally think for me also a vegetarian diet, which is what I have followed. I'm a vegetarian. I have always been. I don't know
Get some
any
of that
better.
too.
So that has helped me, and being Indian, I eat a lot of spices, a lot of other things other than salt. That helps me keep my healthy food intake. So now moving
Absolutely.
on, I just want to make sure that we cover a couple of other topics as well in our allocated time, which I think is critical. Is we face as someone who is sick when we go through dialysis. Yes, we do a lot of things, but there is always a support system that helps us, and some communities resources that we find in general. Personally, I have also been through 3 cancers. So for me, my mother and my husband have been my anchor through everything, and I always say support system is important. So can you share about your support system and what are some resources that people can look out for if they're going for transplant, and something that has helped you go through this journey? Maybe I can start with Dawn this time. Dawn.
Sure. So some resources that have helped me are things like National Kidney Foundation, going to support groups. There were no online support groups when I was first transplanted and even pre-dialysis. So I would take a disabilities transportation up to where the center I was transplanted with, and National Kidney Foundation and American Association of Kidney Patients would hold live meetings in my hospital. I also went to a live event of a convention post-transplant for American Association of Kidney Patients. Now it's all online. So that was an incredible experience to get educated and learn. I also got hooked up when I was on transplant or waiting for a transplant with a person who, by my doctor's permission, asked her if I could speak to her about peritoneal dialysis. So we had great conversations on the phone. I had a PD nurse that also had done that and been through transplant. That was my trainer. I was very lucky and blessed to have that. So anybody that I could reach out to basically was my support. My family was integral. My family was the best thing that happened to me at the time. Still is. Now my family unit has changed and gotten smaller, but my mom, who was also a kidney patient, wanted to give me a kidney and couldn't, and that's how they found out. But my mom was by my bedside through everything. Both my parents, who were long divorced, were there when I was transplanted, praying for me. My mom's sister, my grandfather. So my family was a wonderful support at the time. Now my husband is a most wonderful support at this time. So yeah, family, maybe going to church, I'd say, praying, whatever a person's faith is, if that helps them, no matter what it is, I think is important. Doesn't matter what faith it is. I think that can be important. I did turn to my own faith. Like I said, whatever somebody's is, I respect that. And if it helps you, great. Pets, sometimes having an animal, like George there, sometimes could be like a huge support. Because sometimes you don't have people to talk to. So,
Indeed.
within reason, because the transplant centers don't have this pet or that pet. But I was at my mom's house, so I took advantage of their pets, and the dog stood by me when I had my transplant. So, and I petted them a lot. They were a source of comfort. But support groups. Now I find that support groups online, I'm learning more about transplant than I had when I got the transplant because it was so long ago. All the new research, and that's one of the reasons I'm doing this, is
Indeed.
it's so wonderful to learn the new things and what's happening because someday I just might need another one. Let's hope not, but I might. So I want to prepare myself in an educated way rather than worrying about how much longer this transplant will last. So for me, that's really big. I love Renal Support Network. That's one of my favorites lately because they have a book club and a foodies club and different things as well as their support group. So they have great information on diet as well as the other organizations at AKP, National Kidney Foundation, American Kidney Fund. There's a whole large group of support groups for people with transplants, all kind of transplants, and you just got to choose the right one. That's what I would say is choose the right one. Try a couple because it's kind of overwhelming. Try a couple, see what works for you. Not all groups work for everybody. And that's what's great. There's so many out there. So I think those things are really, big supports. I'm finding more support now and making friends across the country using the internet.
Thank you, Dawn. Thank you. So find the right support group, indeed. Kathleen, would you like to say something more? Because you have a liver transplant, because Dawn mentioned a lot of AAKP and National Kidney Fund, which is all for kidneys. So is there anything else that you would share regarding support system?
As far as the support I got, I spent more time in the hospital in 2015 than I did at home. So most of that support was coming from the medical professionals. My family, however, they basically kept me alive. Unfortunately, with liver disease, you have the tendency for your ammonia levels to go up and down. It's very difficult to know when that's going to happen. The patients, like me, they're so embarrassed by the fact that they can't think clearly that we try to fake people out. I told my wife at one point I was fine. She was taking me to the hospital because I was putting both legs into one side of my pajamas, but I thought I was fine. So it's really critical for the families to understand what a patient with liver disease and cirrhosis is going through, and to kind of key into when their ammonia levels are going up. Because I ended up in the intensive care a couple times with high ammonia levels and had my transplant canceled because of it. We actually used, there's a lot of financial needs after you have a transplant. I don't think a lot of people realize the cost of some of the things that, just the constant visits to the hospitals or the doctors or the blood work or whatever. It costs a fair amount of money. So we did use Help Hope Live, which I'm not promoting them, but they did help us raise money to pay for some of the costs that continued on for the next couple of years. But one thing I do want to say as an ambassador, I've tried to look up different, functioning groups that do help. And I'm cautioning people because I have had people get involved with some groups that are lay groups that don't have the information. They're giving out improper information. In other words, they're not giving out accurate information. And that's kind of frightening to me, that a lay person, they're counting on a lay person to give them good advice. So people have to be really careful what groups they are getting involved in, and make sure that they, are attached to a physician base, and that they have people giving them advice based on actual knowledge of
Great
the
advice.
disease.
Yeah,
Yeah,
that's
so
Great advice.
especially in this era of social media, where there is a lot of misinformation out there. So I think
Oh,
we
yeah.
have to be careful. That's a good insight, Kathleen.
Yeah.
Thanks for
If you
sharing
check
that.
to see if they're legit, a legit nonprofit, that sometimes helps.
Thank
Well,
you.
Because if they're attached to a legit nonprofit, they might be helpful, or they might be able to have administrators who you can contact if there's information out there on their groups that is not legit.
yeah, Facebook has been a big promoter of, there's probably 10 different living donor or liver transplant committees or groups or whatever. And those were the ones that I found that they were run by lay people, and they were not
Okay.
giving out accurate information. So
No.
yeah, that's really good what you're saying. I just don't know that people know how to check to make sure. So
Okay.
just
Yeah.
as a
That's a
caution.
good idea.
Yes.
Okay.
George, I know you've been out there for so long. Tell us how it has evolved over the years. What have you seen?
Well, in the beginning, definitely my family was my support group. I lost my mom about 4 years ago, and Dawn, I may have to call you for some therapy, because she
Anytime,
was
George.
always the first person I looked into when I woke up from any number of different procedures I've had since the transplant. Certainly, there's a group down in Florida that I'm speaking with next month, EMAT, which is Educating Minorities About Transplants. Their leader is a double lung recipient, and I like that they are 501c3. I like that they do get good medical advice from different doctors, from the Mayo Clinic and so forth. My support group has kind of fizzled. I mean, I lean on other long-term recipients. My best friend, transplant recipient, is Barb Witt. She lives down in Georgia, and she's another long-term, 50-year recipient already,
Wow.
2 transplants. And that's what I've come to really lean on, is different groups that I'm in. We've all dropped the alphabets with the NKF and AKF and AAKP. I go back to when AAKP was NAPHT, which stood for National Association of Patients Transplants and whatever it was. I forget now. National. Well, anyway, and so those organizations, I'm still a volunteer for National Kidney Foundation. The executive director, Patty Dash of the Maryland, Delaware branch, recently retired, and but I still volunteer for them. I volunteer for my OPO, which is 2.5 hours away, but everything is from where I live. And that's the Infinite Legacy organization. And I used to volunteer for WRTC until they were acquired by Infinite Legacy. So a lot of the people, including people at UNOS that we heard from earlier, I've called them for advice. I've sought information, written information. People like Kathleen that have recently gotten transplanted, 10 years ago, I believe she said. It's interesting to listen to them because they are part of, I'll say, the new generation of recipients. And so they get new medications, new protocol, they're going through new problems and things that I've just never, ever in the 50 years, I've never experienced. Now, I was at the transplant games in 2022 in San Diego. I got out of the swimming pool and my heart stopped just for no reason. There was no indication that there was a problem. And the next day I woke up with a pacemaker defibrillator, but the kidney is still working even after all of that. So I've certainly learned a lot when I was in the hospital in California. And I've just been very fortunate. And I do have very dear friends in Philadelphia. One is actually being tested to be a living donor right now. And when they thought that my kidney was going to stop 6 years ago, I was going through the process. And this is to encourage anyone whose organ may be failing. My kidney went down to, I want to say 25 GFR. I don't remember what the creatinine was, but the next month it went back up to 45. So my nephrologist, not a transplant nephrologist, but my nephrologist, they just don't understand George Franklin and his kidney that he named retread almost 50 years ago. So it's important. Name your organ. Name your organ. I talk to it. It talks to me sometimes, I think. So Don, stand by. I may be calling for some therapy. But
anytime.
This whole thing today has been so informative. The doctors that spoke, Dr. George, I never knew that India was doing more living donor transplants than deceased donor. I didn't know that was going on anywhere in the world until she said that, and I wrote it down. And so that's interesting. I'm hoping that we can bump up our living donor program because the kidney group specifically, we need the organs. We need, this has allowed me to live nearly 50 years with a deceased donor kidney. And all I take is currently CellCept and 5 milligrams of prednisone. I was even surprised to hear that prednisone, I know it can cause different issues. It's just never caused them with me.
Thank you, George. I think you're blessed and we're happy for you.
I am. Truly,
and
yes.
Yes, you're right. The one thing about human body is it's very adaptable. It adapts to whatever. It can take many things, and especially the kidneys.
Yes.
I think it can survive really long. My kidneys also have seen through a lot of 2 full-fledged chemotherapies. And as you said, mine also failed once where it just went so high, we didn't know what to do. And then it fought back, came back. That's the brilliance of the human body's evolution over billions of years, I guess.
Yes.
I think we might be running out of time from what I see. Just one quick question. I want you to answer that in a single sentence, if possible. Just a short answer for that is, what advice would you give to someone who is going to be newly transplanted? Just one thing.
Very,
think of,
just a half a dozen words. Live your life. You don't know how long the transplant's going to last. So take the cruise, fly to England, visit India, go wherever you want to go, because that's why you got your transplant, to live.
Wonderfully said. Thank you.
Thank
Dawn,
you.
what would be your advice for someone who is getting newly transplanted?
Well, first, what George said, absolutely. And second, do your best to take care of yourself and live gratefully every day. You got that gift, take the best care of it you can, whether it's from a living donor or deceased donor, for you and for them. And just, again, live your life, but take care of yourself. That'll keep you going.
Absolutely.
Thank you. Kathleen?
I think there's so much information that's given to you post-transplant. I advise people to have a notebook, a big one, so they can take notes. I think their caregiver needs to go with them to every appointment, because even though you're starting to function normally, you're on medication for pain. You're still in that anxiety driven mode that you were before your transplant. So you really need to like keep on top of everything that they're telling you so that you can follow through and make sure your journey keeps going in the right direction. And then when you feel like you're there, yeah, go do jazzercise or something.
Thank you. Yeah, indeed, indeed.
That's great.
Thank you to all three of you for this wonderful session. I just want to summarize it with some key takeaways that we learned today from these wonderful panelists. With regards to medications, yes, the medications have evolved over the years, but one thing that I would like to take away is you're going to have side effects. It's not going to be an easy ride. Just ride through it, face the side effects, and you will come out of it. And that's what I have learned from the first session that we had.
Yep.
And then with regards to support system, have somebody around you, have caregivers. As much as you can do it alone, you still need a support system. That's very important in your life. And if at all anything that you want to take away is live life, take care of yourself. Only you can advocate for yourself. As Kathleen mentioned, make notes, make sure you're doing it, and be silly, live life to the full extent.
Yep.
Back to you, Bobby. And thank you, Don, George, and Kathleen once more.
Thank you very much. Wonderful panel discussion there. A lot of information that we learned. Taking us on further to our next speaker, I'd like to bring to you and introduce Colleen Sullivan. Colleen Sullivan is the Director of Public Affairs and Donor and Family Services at CORE, and she oversees public relations, education, marketing to raise awareness and increase organ donation rates.